In this video, I'll show you how to get to the status board. Please keep in mind that each role is going to have a different looking menu, so it may not be in the same place for everyone. On your menu, there's also an option to change your PIN, which you will need to sign medications or blood transfusions. For an inpatient nurse, you'll come up to PCS status board. From here, you'll go to lists. You'll select the appropriate unit. I'm going to go to MedSurg Pod 2, and here we can see our patient status board. In the yellow bar, some of these headers are sortable. You can click on them to sort by that. To see more on your status board, you can come down to your scroll bar and move your scroll bar over to the right. If you see a patient with an orange highlighted name, it means that they have some privacy on their patient account. The TR stands for transfer. The next vital sign status product column is for our TAR, which stands for transfusion administration record. This is where you'll see details about blood product transfusions. The RX stands for restraint expiration. This will tell you the time that the restraints are set to expire if your patient has restraints. Lastly, CCD stands for continuity of care document. There is another video on HealthStream about continuity of care documents and how to ingest them, so I recommend looking at that. As you can see here, this item is highlighted green. If I choose to do so, I can click Add to my list, and it will add that patient to a list for that specific nurse. To change what's highlighted, I'll just click on another name, and I'll say Add to my list again. To see the My List, you'll go to Lists, and then you can go to Detailed RN List, and you can see the 2 patients that I've added. There are 2 ways to open a chart. You can highlight the item here and click Open Chart on your main menu, or in this open column here under the folder, if I click into this space right here, it will launch the chart. To get to the recently accessed list, you'll have to go back to Lists. Here I can see the patients that I've most recently accessed. To get to Find Account, I will go back to Lists. There is Find Account. If I use the name for search, I'll type in the last name, then the first name. And as you can see here, the account number starts with W, and I can search by that W number. And the medical record number starts with A. So I can put that medical record number A in here to also search for patient charts. To get to the Any Location list, we'll go back to Lists. So this list is helpful if you are working in inpatient and you know that you're getting a patient from the emergency department. You can take a sneak peek at that chart by going to the emergency department location. You'll select the appropriate date, which in most cases is today's date. And then you can see the patient charts for the patients that are in ED, and you can take a look at those.